There is a cardiovascular diagnostic test that is the epitome of modern medicine. It's called a CTA, or cardioangiography. It takes about 10 seconds to perform, and within minutes, a full three-dimensional model of your cardiovascular system is created.
Wonder what it's like to get one? Not only what it's like getting the test itself, but anticipating the results or what your heart really looks like? Well, we're going to show you right now, from check-in to final results, the process and the results for our reporter Tom Miller, who's getting his own CTA. Tom, you're doing what we want many other people watching this to do, so let's go for it.
That's right, Janet. In just a couple of minutes, we're going to see together the condition of my heart. This is going to be amazing. Well, the check-in process is just a breeze, and we've got just a quick stop in the waiting room here, and then we're going to go back and get the CTA test itself. You know, I guess I'm a little bit nervous about this. You know, you think about that's going to be my heart up on the screen. All the French fries I've ever eaten are going to be up there on that screen. Dr. Ross will know everything. But seriously, you know, I've been thinking about this, and a lot of people who I've known who have died in their 50s. I have a cousin who was 56, and I think about if they could have just been in this chair and could have done this test, then they would have known, and the problem could have been fixed, and I could pick up the phone and call him this afternoon. So it really is, it's amazing that this can be done, and in just a few minutes, they will have looked 15 years into my cardiovascular future. And there's a pretty big reason why I'm doing this today. And he's actually on spring break. I brought my son David. And buddy, it's good to have you. We're gonna look at this together. You ready?
Yeah, ready.
All right. I'm doing this because I want to be involved in the things that he's doing and in his life, and I want to be around for that. So let's go check it out. Well, so far so good. I can see my heart rate up there, and I guess my blood pressure is okay. It might be a little high. You know, there's only one part of this. Big guys don't like needles. She does a good job of that. You're good, Iris.
Thank you.
I don't feel anything now. I have no idea what they're doing
By the
now.
way, I'm testing your blood right now for your kidney functions to make sure your kidneys can handle the dye, the x-ray dye.
Okay.
The second time I'll come in here and give you a little spray medicine under the tongue. It's nitroglycerin and it opens the arteries for the pictures. It just goes under the tongue.
Here we go.
Okay, so right now, take a breath in, let your breath out. Take another easy breath in and hold your breath. You can breathe. You can breathe. Okay, I'm gonna give you the medicine now. It will make you feel very warm, very fast, and then I'll give you your breathing instructions. Right now, take a breath in, let your breath out. Take another easy breath in and hold your breath there. Don't breathe, keep holding, and you can breathe. You did great. Okay, you can rest your arms down.
I'm going to tell you the test is really nothing. It's a piece of cake. It really is nothing. What they're going to see is going to be more detailed than a catheterization surgery used to be. This is absolutely nothing. This is easy. The test was easy. Now it's time to go face the music. You know, it's really amazing when you think about that everything that I've done, my cardiovascular health for the last 50 years is about to be shown on screen for Dr. Rellis to analyze. You know, I've been working on this TV series, and one thing that really has motivated me in doing these episodes is to take better care of my health. And however this comes out, I am really committed to doing a lot better job of taking care of myself.
Tom?
Hi, Dr. Rellis.
Call me Jim. Good to see you.
How did we do?
Oh, come on in. You did very well. Let me show you some beautiful pictures.
Wow.
This is the most exciting test because I get to show you your heart in motion.
This is amazing.
Isn't that beautiful?
Wow.
We start with color because it's very descriptive. Most people are nervous about their arteries, so let's go right to your arteries. So here are your four chambers.
Okay.
Left atrium and left ventricle have the contrast that you receive mixing with blood because we want to look at the arteries which come off of this part of the heart, the left side. So I'm going to stand on your head and I'm going to look down onto your arteries. Now you notice there is nothing white in there, like bone down here. If you had any calcified plaque, that would show up as white, bright plaque, and you don't have any in the arteries, so if we were to do a calcium score on you, it would be 0. But a quick tour, LAD looks beautiful, there's no white plaque, there is no black soft plaque, which is actually the more dangerous plaque. And as we look at these, they are quite beautiful. So you, my friend, have beautiful coronary arteries.
Wow.
Your heart arteries, all three of them are code normal.
This is amazing.
So I'm going to move the cursor up and down through this artery, and I want you to look right here. And this is the cross section. This is like being inside of your artery. And as I go down, you can see that this is a beautiful dye-filled artery. Again, no white heart plaque, no soft black plaque.
My goodness.
So we get to fly through people's arteries, and if you had a blockage, I would be able to tell you that it's 30%, 60%, or completely blocked.
Oh my.
So there are your beautiful 3 arteries. So to summarize, you have a beautiful heart with normal arteries. There's no hard plaque, no soft plaque. Your muscles are normal, no heart attack in the past. And obviously now you can relax and know that you're not going to die suddenly of a heart attack. Feel good about taking care of yourself and exercising. And if you have those little aches and pains, you know that it's not your heart.
That is amazing.
So we've accomplished a lot with 10 minutes of a CTA injection today and some beautiful pictures.
What a future, huh?
Any questions otherwise that I can answer for you?
Yes, sir. This has been an amazing experience.
Well, thank you for your time.
Thank you.
My pleasure.
All right. Congratulations. What do you think, man? Perfect heart.
Can you believe that?
Dude, that's awesome.
That is amazing.
That is
You
awesome.
know, with my cholesterol and everything, I'm just so thrilled to know that.
Me too.
Your dad's gonna be around for a while.
That's great.
Thanks, Tom. Janet, those few minutes under one of the most advanced diagnostic machines available today has changed Tom's life. Can you imagine, at his age, learning exactly where you are and being able to make the necessary adjustments for a healthy heart for years to come?
Well, you can go find out for yourself. Talk to your doctor today about how you can look into your own cardiovascular future and begin your own journey to a healthy heart.